The heart has a high margin of safety and it is very difficult to break it. This margin of safety is more than 5 times, even for the highest systolic blood pressure. In some pathological conditions, ruptures of the heart, however, occur. These conditions include myocardial infarction and myocarditis. Ruptures are external when the outer walls of the ventricles are torn, and internal when one of the papillary muscles that control the biomechanics of the atrioventricular valves cups is torn or subtorn. In the first case, a person dies during cardiac packing if you do not have time to sew up the gap. In the second case, a person dies from acute ventricular failure if you do not have time to replace the valve. In the wall of the heart there are anatomical stress concentrators, and in some pathological conditions, pathological stress concentrators may occur. I introduced these concepts a long time ago with my friend and colleague in the study of the laws of the strength of the heart, Professor Cantor. Anatomical stress concentrators are essentially geometric stress concentrators. These are places of sharp bends in the curvature of the inner surfaces of the walls of the ventricles of the heart. The boundaries of the transition of the anterior and posterior walls of the ventricles to the interventricular septum, and they transition to the papillary muscles. Pathological concentrators are the changed biomechanical properties of a part of the walls of the heart, both with an increase in rigidity and with a decrease in rigidity in myocardial infarction and myocarditis, which I have named. The highest risk of rupture occurs when the anatomical and pathological stress concentrators are superimposed on each other. The stresses arising in the wall of the heart during its biomechanics are transferred to the stress concentrators concentrated here, which can lead to heart ruptures. How to prevent heart rupture? You should optimize the course of myocardial infarction and myocarditis. I will answer. How it's done? Watch my videos and read my books.